Oh, got it. Okay, my name is Ahava McLaughlin. I am a traditional naturopath, and today's topic is infertility. And we will then hear from B and then Dr. Imran afterwards, and can't wait to hear about the protocols on this one. Okay, such a big topic. It is something that really has been a growing trend issue, at least in the United States, I know for sure. I'm sure other parts of the world are being affected. Infertility. It is a very, very huge topic, and lots of IVF treatments are being solicited because of it. There are many different factors as to why this is happening, from just diet to miasms, vaccinations, causing infertility, as well as birth control is contributing towards the infertility issue. There's really a lot to look at here as to why it could be happening. Now, some things that we can do to make sure that we are having a good support system is to make sure you're not, obviously not, I say this every week, the sugar is so important to have such a low amount in the diet because it really contributes to health problems. And specifically, at least in the United States, a lot of the milk is treated with hormones, and the cows are not in the best condition, and the milk is dead, which we're getting in the store unless you're getting raw milk or not homogenized milk. And this can contribute to a lot of issues as well with fertility and throwing off hormones, making sure that the gut is balanced with good flora, the intestinal lining is strong, there's digestion going on. The nutrient absorption, assimilation, and distribution to around all the cells and organs in the body is critical. And so having a strong digestive system and not eating inflammatory foods is going to be key. Now, for men, foods, lycopene foods, is going to be very helpful for them in their sperm. And lycopene rich foods are, I think the highest one is tomatoes, watermelon, papaya, mango. Let me see. There's a list. You can Google it. Lycopene, Lycopene, lycopene rich foods. And that for men is going to be great. Vitamin E, vitamin C, vitamin D, CoQ10 is great. And for women, including vitamin D, CoQ10, vitamin C on a daily basis, vitamin E. We're also going to look at herbs like chasteberry and maca root, and Vitex from Gaia Herbs sells a nice one. You take 2 capsules in the morning. Now, also, red raspberry leaf tea is great for uterine support for women and for hormones. DIM plus is a broccoli extract that helps balance out hormones. So that could be something to consider as well. Wild yam cream, progesterone, natural progesterone can be used topically on the forearms and inner arms. Let's see, progesterone, yes, okay, fine. So the DIM is balancing out the estrogen, extra estrogen in the body, to calm down everything. Hormonal wise, we can look at the DHEA levels, the pregnenolone levels. Now, follicle stimulating hormone, that is one that wheatgrass drinks have been really helpful for, and I have actually seen clients bring this number up when they go through these testing for IVF treatments. Follicle stimulating hormone with wheatgrass. It's amazing. It really oxygenates the blood. It gets things moving, and so that is highly recommended. And let's see if there's anything else I wanted to share today. I mean, it's a broad topic. It takes lots of patience, time. Obviously, de-stressing is one, because if you're stressed about not getting, pregnant, that can prolong and add to the list of worries and communicate cells in your body to say, hey, I'm not ready, I'm afraid, and that is not the ideal environment that we want to have. So working on any emotions and traumas and really surrendering to the process and being patient can be also critical in one's journey with infertility. So I think that's what I have to say for today. And thank you so much, Dr. Imran, for having me on. And I'll pass the mic on to V.
Thank you for that valuable information, Ahava. We always appreciate your input. Hi, everyone. This is B. Coleman, and I'm not a homeopath, but I have been an avid learner of natural medicine since 2000. Infertility. As Ahava mentioned, there's been an uptick on that. And I would even venture to say even more so since the dreaded C and the skin penetration procedure that came with it. I started hearing about and seeing a lot more infertility, miscarriages, just a lot of problems that come with that. So as you're looking at infertility, always look at it from that perspective as well. Ask the questions that are necessary and treat those issues. And it might take you a long way. Okay. The Banerjee protocol for infertility is as follows. The first line, calc carb 30C twice a day. Calc carb 30C twice a day. The next remedy on that is Sepia 200C once every third day. And finally, Pulsatilla nigricans 30C twice a day if your eggs are not dropping. That's Pulsatilla nigricans 30C. The second line protocol is Sepia 6C mixed with, that is at the same time with, Conium Mac 3C. Conium Mac 3C. This combo is taken twice a day. And separately, you would also be taking, again, Pulsatilla nigricans 30C twice a day if your eggs are not dropping. The third line protocol, Aurum Mure Natronatum, Natronatum, Aurum, A-U-R-U-M, Aurum Mure Natronatum 4X, taken twice a day. The second remedy is calc carb 30C twice a day. And again, Pulsatilla nigricans 30C twice a day if your eggs are not dropping. These are all taken separately. And that's what I have for female infertility. The only thing I know of that I'm aware of for male infertility is Oramet 200C every third day. Now, for those with remedy makers, I found some rates in the Yvonne Combe rate chart, and these are base 10 rates. The first one is called infertility, and the number for it is 11355. Infertility 11355. The next remedy, rate is called infertility female. The rate for that is 1123. Infertility female 1123. And the last one there is infertility male 1112. Infertility male 1112. And as usual, you're going to have to determine the potency and dosage frequency, as those are not provided when in the rate charts. And that is all that I have, folks, on infertility. And I now pass you on to our esteemed Dr. Imran. Oh, if there's any questions, please let me know.
Thank you very much, B. Bismillah Rahman Rahim. Here is Dr. Imran from Pakistan. So today we are talk about topic is infertility. Homeopathic treatment for infertility is mainly achieved throughout the administration of constitutional homeopathic medicine. Found more suitable after a detailed case analysis. A detailed case analysis include the general physical and mental constitutional makeup of the patient plus the symptoms in the sexual sphere and the underlying causes. The for infertility process and need to correct it. Homeopathy for infertility are natural remedy that help by raising the patient immunity to remove the obstructions that is hindering the process of fertility in a couple. So first we are infertility in women. So first remedy is borax, Borax, borax. Borax is a medicine for infertility in females when the vaginal discharge is like the white of an egg, copious and warm. In such cases, borax favor easily. So we are use borax in 30C, borax in 200C, and borax in 1 m according to the patient condition. Next remedy is natrum phos. Natrum phos is indicated for infertility in women who have irritating creamy honey colored vaginal discharge. The discharge also smelly. So we are use natrum phos in 3x, natrum phos in 6x, and natrum phos in 30C, natrum phos in 200C, and natrum phos in 1 m according to the patient condition. Second one is for infertility in female due to profuse or prolonged periods. Here is two excellent remedies for infertility in females from profuse or prolonged periods. First remedy is a calcarea carb. Calcarea carb, CALCAREA, calcarea carb is mainly used when a female with infertility has too profuse and too long lasting periods. The periods also appear before time. So we are use calcarea carb in 3x, calcarea carb in 6x, and calcarea carb in 30C, in 200C, and 1 m, 10 m, 50 m, and cm according to the patient condition. So next remedy is Altras farinosa. ALETRIS Altras farinosa. The main symptoms are early and copious menses with infertility, leukorrhea, anemia, weakness, tiredness, and fatigue may also present with among these medicine for infertility in females, Latus farinosa is also suggest where a tendency for frequent abortion in present. We are use Elatus farinosa in mother tincture in 1x, in 2x, in 3x, in 30C and 200C according to the patient condition. Third, for infertility in females with short snatty periods. First remedy is Pulsatilla nigra. Pulsatilla is a natural medicine for infertility in women who have faced menstrual irregularities since the menses always get delayed and never appear on the expected date. The menstrual discharge is also snatty and remains for a very short time. Pulsatilla also top the list of medicine for infertility in females suffering from PCOD. We are use Pulsatilla in mother tincture, Pulsatilla in 1x, Pulsatilla in 2x, Pulsatilla in 3C, Pulsatilla in 6C, Pulsatilla in 30C, Pulsatilla nigra in 200C, Pulsatilla nigra in 1M, Pulsatilla nigra in 10M, Pulsatilla nigra in 50M, and Pulsatilla nigra in CM according to the patient condition. Next remedy is sepia, SEPIA, sepia. Sepia is for infertility in females where the menses are short, snatty, and suppressed, along with the prominent symptoms of Birion dawn sanction in uterus may be present. We are use sepia in 30C, sepia in 200C, sepia in 1M, sepia in 10M, sepia in 50M, and sepia in CM according to the patient condition. Next remedy is next for infertility in females with decreased sexual desire. First remedy is Agnus castus, AGNUS CASTUS, Agnus castus. Agnus castus is used when to sexes their excessive masturbation may be a cause behind this. The genitals are also relaxed with transparent vaginal discharge. We are use Agnus castus in male tincture, Agnus castus in 3C, Agnus castus in 6C, Agnus castus in 12C, in 30C, in 200C, and in 1M, and in 10M, and 50M, according to the patient condition. Next remedy is sepia. Sepia is also used for infertility in females having low sex drive. The vagina may be excessively dry with pain while intercourse. Bearing dawn sanction is also a marked feature that may appear. We are used sepia in 30C, sepia in 200C, sepia in 1M, sepia in 10M, sepia in 50M, and sepia in CM, according to the patient condition. Infertility in females due to non-retentions of sperms. Infertility in females due to non-retentions of sperms. Among the various remedies for infertility in females from non-retentions of sperms, top grade remedy is natrum car. Top grade remedy is natrum carb. Natrum carb is very effective for women who have sterility from non-retention of sperm, offensive and irritating vaginal discharge may also be present. We are use natrum carb in 1 natrum carb in 10 natrum carb in 50 natrum carb in cm. I always see a very good result in high potency. So next I want to talk about next remedy is Sabina. 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 Sabina treats women who have recurrent miscarriages, treat inflammations of ovaries and uterus after an abortion. So we are used Sabina in 30C, Sabina in 200C, and Sabina in 1 according to the patient condition. Next remedy is Silicea, Silicea. Silicea. Silicea boosts the immune system and improves chances for pregnancy. We are use Silicea in 6x only, according to my experience. Next remedy is Aurum metallicum, Aurum metallicum. Treats infertility caused by depression, feeling of self-hatred, and wrathlessness. Treats high blood pressure, treats enlarged and prolonged uterus. We are use this remedy in 30C and in 200C and in 1 according to the patient condition. So next remedy is phosphorus. PHOS, PHORUS, phosphorus. Phosphorus treats infertility due to uterine polyps, infertility due to anxiety and stress. We are use phosphorus in 30C, phosphorus in 200C, and phosphorus in 1 according to the patient condition. Next, I want to talk about infertility in males. Infertility in males with erectile dysfunctions. There are some top match remedies for infertility in males for erectile dysfunctions. Homeopathic medicine, first remedy is Agnus castus. Agnus castus is best picked up with both sexual desire and physical ability are lacking, genitals are lax, flakes, and cold. We are use Agnus castus in mother tincture, Agnus castus in 3C, Agnus castus in 6C, Agnus castus in 30C, Agnus castus in 200C, and in 1 according to the patient condition. Next remedy is Caladium sac. Next remedy is Caladium sac. Caladium, Caladium sac. Caladium sac is best choice for impotency with mental depression. Sexual desire is present, but the genitals are relaxed with weak erections. So we are used caladium sag in maltension, caladium sags in 3C, caladium sag in 6C, caladium sag in 12C, in 30C, in 200C, and in 1M according to the patient condition. Next remedy is selenium, Selenium, selenium. Selenium is also best among the various medicines for infertility in males from erectile dysfunctions. Selenium is helpful for slow weak erection with rapid emissions. Involuntary semen discharge may also be present. So we are use selenium in 3x, selenium in 6x, selenium in 12x, selenium in 30C, selenium in 200C, selenium in 1M, selenium in 10M, selenium in 50M, and selenium in CM according to the patient condition. Next, infertility in females with low sperm count. Infertility in males with low sperm count. X-ray top the list of remedy for infertility in males from a low sperm count. It helps to increase sperm count. It helps in both improving the quality and quantity of sperms. We are use X-rays in 30C, X-rays in 200C, X-rays in 1M according to the patient condition. Next, infertility in males with orchitis. Conium is top grade homeopathic remedy, the chart of medicine. Infertility in males. Conium is top grade homeopathic remedy, the chart of medicine for infertility in males. It is used when the testicles are swollen, hard, and enlarged. It is also effective when a history of suppressed sexual desire is present. So we are use conium mac in 30C, conium mac in 200C, and conium mac in 1M according to the patient condition. Next remedy is infertility in males with wasting of testes. Sebel sarolata is one of the best remedy for infertility in male with wasting atrophy of testes. It is also the perfect remedy for infertility in males with prostate enlarged.
Would you
So
spell
we
it?
are
Would you spell it?
SABAL, Sabal, SERRULATA, Sabal sarolata. We are use Sabal sarolata in myrrh tincture, Sabul Sarolata in 1x and 2x and 3x and 30C and in 200 patient condition. So anyone have a question on this topic? So I'm here to answer.
Do you have any protocols that you use on a regular basis?
Anyone have a question about this topic?
Yes, Dr. Imran, do you have any protocols that you use on a regular basis?
Okay, so we are use first protocol for all type of infertility in females. My first protocol is Ashoka in Maratanchar, Ashoka, Ashoka in Maratanchar, Pulsatilla nigra in Mother Tanchar, and Gossypium, Gossypium, Gossypium in Mother Tanchar, and Elatrus farinosa, Alteris, Elatrus, Farinosa, Elatrus farinosa in Mother Tanchar. Mix these four myrrh tincture as equal and use 3 times a day. 10 drops 3 times a day. So next protocol, if infertility due to short periods, then we are use Elatrus farinosa in myrrh tincture and Spina 30C, Calcarea carb 30C, and Murex 30C, Murex, Murex 30C, Sabina, Spina 30C, and Calcarea carb 30C. Mix together these three remedies and use 3 times a day. If infertility due to vaginal discharge like leukorrhea, then we are use Calcarea floor 200C, alumina in 200C, and sepia 200C. Calcarea floor 200C, alumina 200C, and sepia 200C. Mix together these three remedies and use 3 times a day. If infertility due to polycystic ovaries. Then we are use polycystic ovaries are 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 fibroids. Then we are use aurum in 3x, aurum in 3x, Beta-carbon 200C and Lexis 200C separately, both remedies 3 times a day. And Ashoka in myrrh tincture, regular 10 drops 3 times a day. Ashoka is top grade remedy in all type of infertility patients.
Was the third remedy lachesis?
Yeah, Lexis in 200C.
Okay.
So now I want to share some protocol for male infertility patients. So my first and top grade protocol is X-ray in 200C 3 times a day, Nectromure 6x and Silicia 6x. Mix together these two remedies and use 3 times a day. So second protocol is Damiana, Damiana in myrrh tincture 10 drops 3 times a day, and selenium 200C 3 times a day, and lycopodium 30C 3 times a day. So most important thing in male infertility patients, we need to know about a semen analysis report. If in semen analysis report have a pus cells in semens, then we need to work, then we need to cure, then we need to first fix the pus cells. So for pus cells, top grade remedies, heparsulfs, merxols, heparsulf, merxol, medorinum, puja. These are all top grade remedy for pus cells. And if sperm counts, low sperm count due to high pus cells, then we need to use first some doses of in hypertension heparsulf like 1 m or cm, merxol 1 m cm some doses, and second one we need to use a Damiana in myrrh tincture 3 times a day. So anyone have a question about this topic? Anyone have a question? So I want to say thanks to everyone. Next Sunday, same time, we meet again here with new topic. And thank you very much to all.
Thank you, Dr. Imran.
Thank you.
Always welcome.